Hi, this is Dr. Elisha Van Dusen at New Hope Chiropractic. Have you ever wondered why high heels are bad? We hear all these things about how wearing high heels can mess up your back, your spine, and cause problems with your ankles and feet and knees. Well, why is that the case? I thought that would be a good thing to look into because about 72% of women will wear high heels at some point in their lives and do so on a regular basis. Although the percentage of women who are wearing high heels on a regular basis has actually gone down since the mid 1980s, there's still a lot of women who wear heels, and they mostly um, wear high heels with special occasions. About 77% of women will wear high heels out for special occasions. 50% will wear them at parties and out to dinner. 33% of women wear them for dancing, and about 31% of women wear high heels for work. But how do high heels really affect you? A woman's body will attempt to compensate for the off-kilter balance heels cause by flexing or forward bending the hips and spine, and in order to maintain balance, the calf, hip, and back muscles will become very tense. And at the end of the day, this makes for excess muscle fatigue and strain. Over time, wearing high heels can also cause the calf muscles to cramp and to bulge. So with flat shoes, your spine is really in optimum shape and position. The spine is fairly straight, the calf muscles are relaxed when the feet are flat, and their flat shoes also help evenly distribute the body weight throughout the foot. However, when you wear high heels, the chest is pushed forward, the lower back is pushed forward, and this takes the hips and spine out of alignment. There's excess pressure placed on the knees, and your heels will mimic the way a person walks on a ramp, increasing the pressure on the balls of the feet through a downward force. So this puts a lot of pressure on the balls of the feet and also the toes. The normal S-curve shape of the back acts like a shock absorber, and it reduces stress on the vertebrae and the discs. Well, wearing high heels causes your lumbar spine, your low back, to flatten, and then there's a posterior displacement of the head on top of the upper back, the thoracic spine. So high-heeled shoes will actually cause you to lean forward and will alter the body's response, and that lowers the body's, the spine's, the lumbar spine's ability to actually act as a shock absorber. A high-heel shoe places an increased amount of pressure on the forefoot, causing you to adjust the rest of your body to maintain your balance. So the lower part of the body leans forward, and to compensate for that, the upper part of the body has to lean back to keep you balanced. Also, daily high heel use over a number of years actually leads to changes in the anatomy. If you're teetering on stilettos all the time, it puts a lot of stress on the back and knees as the weight of the body shifts forward. Calf muscles can shorten and tendons can thicken with time. And also you can have slippage of one vertebra forward over another called spondylolisthesis. And this usually occurs as a result of wearing high heels, especially in the low back, the lumbar spine, where the body's weight is most concentrated. And as I said before, the shock absorbing components of the spine, of the lumbar spine, are decreased with high heel use. Also, there can be foraminal stenosis. It's a spinal nerve condition that can occur when anatomical abnormalities block or reduce space in one or more foramina. And foraminal stenosis in the lower back can cause symptoms like shooting pains, numbness, tingling, muscle weakness, spasms, cramping, and also pain that radiates through the buttocks and down the legs. Sciatica can also be caused by compression of the sciatic nerve, and it's also a term that's often associated with this particular set of lower body symptoms. So again, that's encroachment of the opening of the nerves as they're coming off the spinal cord. The heel's height determines the weight carried by the footwear, and as the heel gets higher, the pressure increases in the forefoot and the ball of the foot. With 3-inch heels, there's 76% more pressure. 2-inch heels, 57% more pressure. And only with a 1-inch heel, that pressure on the forefoot is decreased by about 22%. So some good recommendations and things to consider if you will still be wearing high heels. These can help mitigate some of the adverse consequences of wearing those high heels. So just try not to wear them for long periods of time. Stretch your leg muscles before and after putting them on, like a runner's type stretch on the calf. Try to set your limit to 2 inches. And buy shoes in the afternoon when your feet are at their largest. Avoid pointed toe shoes, opt for shoes with leather insoles, which helps keep your foot from slipping, and just buy a wide variety of different shoes and vary your footwear day to day. Don't wear the same shoe 2 days in a row, alternate days. That helps them to dry out and also gives your foot a change, a rest from any particular type of shoe. So it can minimize the damage with wearing high-heeled shoes. So hope this helps. Check us out at newhopechiropractic.com, and also adjustments of the lower extremity, the leg, the knee, the foot, and the ankle can also help with preserving your feet and helping you to walk better, as well as getting the low back adjusted, especially, again, if you're wearing high heels a lot. So until next time, have a healthy day.